discuss about polyarteritis nodosa. Polyarteritis nodosa is necrotizing arthritis, that is, it is a medium-sized vessels vasculitis that involves almost all medium-sized vessels of the body except in the lungs. So it is a systemic condition that involves multiple organ systems of the body. It is associated in 10% of the cases with the hepatitis B virus, and sometimes there are mutations in the adenosine deaminase 2. Adenosine deaminase 2 mutations can lead to early onset polyarteritis nodosa. What are the signs and symptoms that are related to this condition? As it is a systemic condition, therefore fever, malaise and weight loss are observed in this disease. Weight loss more than 4 kilogram, and it is unintentional. That is, it is not related to diet or other things. Then it is unintentional weight loss that is seen in polyarteritis nodosa. Myalgias, weakness, leg tenderness due to blockage of the or stenosis of the arteries due to vasculitis, neuropathy due to vasculitis of the blood vessels that are supplying the nerves, livido reticularis due to the involvement of the blood vessels that supply the skin. Actually, this is webbing of the blood vessels that appear on the skin. Then there is testicular tenderness, and it is mostly due to stenosis of the blood vessels that supply the testes, and lower extremity ulcerations due to decreased blood flow to the lower extremities. Kidney damage is also seen, and in this case there is renin-mediated hypertension. And creatinine and urea is raised. Furthermore, there is intestinal ischemia that can lead to acalculous cholecystitis plus acute appendicitis. Furthermore, in some patients it can lead to rupture of the intestine. It can also cause coronary vasculitis because it is a medium vessel vasculitis. Therefore, it can lead to myocardial infarction. How can you diagnose this condition? When you do CBC, you will find anemia like other chronic diseases. CRP is raised when there is acute inflammation. It is ANCA negative vasculitis, and you will diagnose it through tissue biopsy. When you take a deep biopsy of the affected area, then you can diagnose this condition. Furthermore, if there are clinical features of polyarteritis nodosa, then you can diagnose through the vascular imaging, because on vascular imaging there are aneurysmal dilatation of the blood vessels. Furthermore, there is narrowing of the blood vessels, especially of the renal, mesenteric and hepatic arteries. How will you treat this condition? This condition is treated initially when there is acute phase. Then you will give pulse therapy. What is pulse therapy? You will give 1 gram intravenously methylprednisolone. 1 gram intravenously methylprednisolone. It is given for 3 days IV 1 gram, and you can add this cyclophosphamide immunosuppressant along with this methylprednisolone, and when you give pulse therapy with these two agents, then you have to shift to maintenance therapy when disease flare is controlled. And maintenance therapy consists of azathioprine or methotrexate. Especially the disease is when controlled by cyclophosphamide, then maintenance therapy mostly depends on azathioprine or methotrexate.